Most people over the age of 60 think forgetfulness is the start of dementia. Some confuse dementia with Alzheimer's disease, not realizing that Alzheimer's is just one type. Hi, I'm Sylvia. In today's video, we will learn about dementia. US surveys show that dementia is one of the most feared health conditions after cancer, often because it affects personality and decision making. Fear of losing independence is the biggest concern. People often worry about becoming a burden on family. What if I told you dementia is not a disease? That dementia is a condition. Do you assume it's an inevitable part of our aging process? Well, it's not. Many people will never develop dementia. Let's clear up some common misunderstandings. Dementia is not a single disease, but an umbrella term for a range of neurological conditions that result in a decline in cognitive function, such as thinking, remembering, and reasoning, to a degree that it interferes with a person's daily life. It is caused by damage to brain cells, which affects their ability to communicate with each other. There are several types, with the most common being Alzheimer's disease, the most prevalent form of dementia, caused by abnormal protein buildups in the brain called amyloid plaques and tau tangles. Vascular dementia, the second most common type, caused by reduced blood flow to the brain, which can be the result of a single stroke or a series of mini strokes. Lewy body dementia, LBD, characterized by abnormal deposits of a protein called alpha-synuclein in the brain. Symptoms can include problems with thinking, movement, behavior, and mood. Frontotemporal dementia, FTD, a rare form of dementia that tends to affect people under the age of 60. It is associated with damage to the frontal and temporal lobes of the brain, leading to changes in behavior and language. Mixed dementia, a diagnosis that occurs when a person has brain changes associated with more than one type of dementia, most commonly Alzheimer's disease and vascular dementia. Well, that is a lot of information to consume, but don't worry, you don't have to remember it all, just know there is different types of dementia. Samuel will explain some of the symptoms to help you better understand dementia. Stay tuned because he will also explain diagnosis and treatment for dementia. Samuel?
Thank you, Sylvia. Hi, I'm Samuel, and I'm here to help you better understand dementia and some common symptoms. Diagnosing dementia can be a little tricky, so always consult with your doctor if you believe you have any of these symptoms. Signs that are usually normal aging and not dementia are occasionally forgetting where you put your keys or glasses, taking longer to recall a word or name, but eventually remembering it, needing more reminders, lists, or calendars to stay organized, sometimes walking into a room and forgetting why, but recalling it later. These things can be frustrating, but most often not real signs of dementia. These are symptoms of the brain getting older, and our processing time is slowing down. Doctors suggest paying attention if you notice these following symptoms. 1. Memory loss that disrupts daily life. Forgetting recent events, repeating the same questions, or relying heavily on others for reminders. 2. Difficulty planning or solving problems. Bills not getting paid, recipes you used to follow becoming confusing. 3. Trouble with familiar tasks. Forgetting the rules of a game you've played for years, or struggling to operate the microwave or TV. 4. Confusion about time or place. Losing track of dates, seasons, or where you are. 5. Language problems. Difficulty finding words, following conversations, or mixing up names of common objects. 6. Poor judgment. Giving away money to scams, neglecting hygiene, or making unsafe choices. 7. Withdrawal from social or work activities. Avoiding hobbies, friends, or social events. 8. Changes in mood or personality. Becoming unusually anxious, suspicious, depressed, or irritable. Again, you should always consult with your doctor if you believe you are experiencing one or more of these symptoms. Early detection can help slow down and sometimes help prevent onsets of dementia. Don't forget to smash that subscribe button and the like button. Diagnosis and treatment. Diagnosing dementia involves a thorough medical history review, physical and neurological exams, cognitive and neuropsychological tests, and sometimes brain imaging. There is no single test for dementia, Currently, there is no cure for most types of dementia. However, there are medications and other treatments that can help manage symptoms and improve quality of life. These include medications. Some drugs can temporarily improve symptoms by boosting chemical messengers in the brain. Cognitive stimulation therapy, CST, group activities and exercises designed to improve memory and problem-solving skills. Occupational therapy, strategies to make the home environment safer and help with daily tasks. Lifestyle adjustments, regular physical activity, a healthy diet, and social engagement can also be beneficial. In short, you will know when it is time to get checked if your memory or thinking problems keep getting in the way of everyday life, not just once in a while. Before I give you back to Sylvia, be sure to click the subscribe button and like button so you won't miss our next learning video. Remember, our main goal is to keep you maturing happy and well. Stay well, my friend.
Thank you, Samuel. So talk to your doctor. A primary care doctor can run simple memory tests and rule out other causes, like vitamin deficiency, thyroid issues, stress, or medication side effects. Don't panic. Many memory lapses turn out to be normal aging or something treatable. If your memory or thinking problems keeps getting in the way of everyday life, not just once in a while, it is a good idea to consult with your doctor to get professional advice and care. Subscribe to this channel so that you do not miss out on any of our learning videos that's intended to keep you maturing happy and well. Stay happy, my friend.